Thanks, Murray. John, I feel shamed. You've been in the project 3 weeks and you're appearing on ABC Radio. I'm still getting my head around. I'm also fairly new to the project. I've come from a background, I'm a neuroscientist. I've done most of my work in the top end and down here in the centre, looking at the impact on brain and behaviour of substance abuse, mainly petrol sniffing and alcohol. And, you know, on a positive note, the recovery associated with that. So moving into this project there, I'm transitioning out of that now and to work wholly in this project, which is quite refreshing to be looking at working with the sort of more social determinants of some of those more devastating health and social problems that happen at the end stage. So just to give you a little bit of perspective, my position will be with the Centre for Remote Health, based in Alice Springs, which is a Flinders Uni appointment, but I'll be actually living in Melbourne. As Ashley pointed out, I'll be making a bit of a carbon footprint. But my project will overlap with quite a lot of the projects here, so it's really good to get a good grasp on what they involve, and I look forward to working together to make sure that we kind of optimise the investment that we put into the projects and get the most out of them, so that they align closely together, and perhaps the information from this project, it informs an evaluation perspective some of the outcomes of other projects. So this project will take a whole of system approach to have a look at the interplay. We're calling this the Interplay project, to step away from an acronym that would look like HWEE. So we're looking at the interplay, or the interconnections between health, wellbeing, employment and education. So this will involve setting up a conceptual framework, a long sort of lead up time working with the end users, being Aboriginal and community groups and government groups, to develop a conceptual framework that will encompass the cultural and social, economic and health and biophysical factors in a remote situation, and then using this conceptual framework to set a baseline for monitoring change in health and wellbeing under the influence of different influences. The intention is to set the study up as a longitudinal study that will continue beyond the life of the CRC, hopefully with additional funding. The basis will be to provide an evidence base for monitoring health and wellbeing impacts, or monitoring the optimal investment of different factors to optimise or maximise the health and wellbeing outcomes to fit in with national policy and meet closing the gap targets. A lot of time in the first few years we'll spend looking at how to define and measure each of these factors, which will build in biomedical models, also build in cultural and political models, so that we can interpret the findings in a lot of different frameworks, with data collected at the level of the individual and probably also at the level of the family, the community and the national policy level. And just at this early stage in the project, the broad idea is to combine existing and survey data across 6 to 10 different Aboriginal settlements, remote settlements, comprising 5,000 to 6,000 individuals, with data collected by the trained Aboriginal researchers, possibly that Mark was talking about earlier. So that's all I have for you. I look forward to meeting with everybody and working together to see how the different projects can be built into this.